All right, recording is in progress. We are going to go ahead and progress into the next section of this meeting. So welcome, folks. Some of you I've had the pleasure of seeing on at least one other meeting today, some of you too. So hello again, and nice to see the people who I haven't seen yet today. So I'm Miranda Ramos. I work for the Alliance for Rural Community Health, which is a countywide consortium of the federally qualified health centers in our county and one rural health clinic. And I happen to be the current chair of the Healthy Mendocino leadership team. So hence me kicking off this meeting for y'all. I want us to go ahead and we're going to do introductions. We're going to do it. Please be pretty brief because there's a bunch of us here. Tell us who you are. Tell us who you're with. I'm going to call on folks just so we can get through it all. And then I will have a quick announcement and then we'll move into the bulk of the meeting. So I am going to go ahead and Jennifer, you happen to be the first person to introduce yourself.
Hi everyone, Jennifer ODonnell, 59 Greater Than Wine Country, and I've been with Healthy Mendocino for several years, and happy to see you all.
Great, thanks. Leah.
Good afternoon, I guess, everybody. My name is Leah Holbrook. I am the programs manager with the Mendocino Coast Healthcare Foundation, a grant giving organization here located on the coast that supports organizations serving the health and wellness needs.
Welcome, Leah. Mary.
Good afternoon. I'm Mary Norris, and I'm the chairwoman of the Caddo Tribe here in Laytonville. Nice to see everybody.
Good to see you, Mary.
I will have to leave early today, too.
Oh,
I'm sorry.
Okay, no worries. Thank you, Mary. Juliana.
Hey everyone, my name is Juliana Sanchez, and today I am here with Mendocino Coast Children's Fund, our nonprofit serving the Mendocino Coast.
Welcome, glad to have you join us. Sage.
Sage San Giacomo, city manager for the city of Ukiah.
Good to see you. Joanne.
Hi, everyone. I'm Joanne Sacato. I'm the Community Engagement Coordinator for Lake and Mendocino Counties for the NorCal for Health Project. We are working on community health at the level of policies and planning.
Welcome. Lily.
Hi, I'm Lily Caravello with Mendocino County's Advocacy and Collaboration Team.
Good to see you again. Michelle.
Hi, I'm Michelle McMillan with the COVID Response Network. Good to see you all.
Good to have you here. Roseanne.
Good afternoon, everyone. Roseanne Ibarra, Director of Community Wellbeing for Adventist Health.
Hi again, Roseanne. Steph.
Hi, Stephanie Gold from Anderson Valley Housing Association out in Boonville. And thank you for inviting me.
Great, it's wonderful to have you here. Clinton.
I'm Maxwell, Mendocino County Office of Education, and I help support our school districts in preparing students to be ready what comes after graduation.
Hi, Clinton. Julie.
Hi, everyone. Julie Featherston, Executive Director of First Five Mendocino.
Hello again. Lisa.
Hello, I'm Lisa with Public Health Nursing. I'm Director of Maternal Child Adolescent Health and Home Visiting Programs. Happy to be here with y'all.
Happy to have you here, Lisa. Victoria.
Hi, Victoria Kelly, CEO for Redwood Community Services. Happy to see everyone, and I do have to leave at 2.
Thanks for letting us know. Supervisor Williams.
Ted Williams, County Supervisor.
Glad to have you join us today. Tammy.
Tammy Moss Chandler. I'm currently the Development Director for North Coast Opportunities, and I've worked with Healthy Mendocino in a variety of ways over the last 5 years.
Good to see you. Donna.
Hi, Donna Schuler, Mendocino County Public Health, and I'm really excited about today's roundtable here. working with Healthy Mendocino for probably 7 years now in various ways.
Great. I always appreciate that you have a different backdrop each time. I'm like, oh, she goes to beautiful places. I've got somebody who is called in and it just says iPhone, so I don't know who to call on, but if you are
Yep.
iPhone,
Hi,
tell us who
Miranda.
you
It's
are.
Chloe.
Chloe.
Hi, I'm Chloe. I'm the director at Anderson Valley Health Center.
Thanks, Chloe. Good to have you here. And Dina.
Hi, everybody. This is Dina Polk. Director for the Domestic Violence Rate Crisis Center serving Mendocino County.
Thanks, Dina. So it sounds like you're having some slow internet issues. For those folks who don't know, I have the benefit of having just been on a meeting with Dina where she introduced herself. So I can tell you that she is the executive director of Project Sanctuary, in case you didn't know. Hopefully you can hear us okay, Dina. All right. So I think I got everybody. Wave frantically or unmute yourself and scream quietly if I missed you. I don't think so. Okay. If we have other folks join us, we will do our best to get those folks introduced as the meeting progresses. I want to take this opportunity at this moment to announce a couple of big, some exciting, some a little nerve-wracking changes for Healthy Mendocino, and also express gratitude. I will start with the first piece of news that we had last week, which is we're very pleased to report that we've recruited a new coordinator for the Healthy Mendocino program. Those of you who've been here for a while know that Molly has moved on to a different position within NCO. And so we did a recruitment thanks to Patrice and Tammy and the HR team at NCO who made that work, and the people who served on the interview committee. And we're happy to report that we have offered and the position has been accepted by Jamie Williams, who is of Fort Bragg, and she'll be working part-time starting, I think, next week with Healthy Mendocino. So we are happy to report that piece of information. It was a great pleasure to meet her, and we're looking forward to her joining us in this and other Healthy Mendocino activities in the future. So welcome to you, Jamie, wherever you are before you've started this job. The other piece is an even bigger piece of news, and, you know, exciting in the way that, like, I don't know, getting ready to go on a big trip is exciting, but sort of nerve-wracking also. Patrice is going to be moving on from Healthy Mendocino to an exciting new opportunity that really aligns with her values and what she does. And so we're really excited for her in that opportunity, and also tremendously grateful to Patrice for the years that she has worked with Healthy Mendocino and everything that she has done to strengthen the organization, to help make connections, and also her ongoing commitment to help us in thinking about next, you know, what the next steps are around recruitment and planning and all of those kinds of items. So I want to stop talking for 30 seconds to give folks a chance to, you know, like throw your emojis around and yell thank you through your phone or whatever it is you're going to do. So thank you so much, Patrice.
Absolutely. I want to thank Patrice as well for all that she's contributed to Healthy Mendocino. She's been there from the beginning and poured her heart into the initiative and brought us to where we are today. So thank you so much for a job well done, and best wishes on your next journey.
Yes.
Thank you, everybody. I appreciate your well wishes, and it's with mixed emotions that I move on, because I really have enjoyed working with Healthy Mendocino on the work that's being done in the county. But But I'm moving into what Miranda was talking about, is into more in the environmental nonprofit world, which was my first love when I was up in Humboldt State, getting a wildlife biology degree. So I'll be working for the Redwood Forest Foundation over there on the coast and being their business manager. So I am excited about that. And but I still will be around for a while, and I'm still in the area. So I'll be able to help with the transition to a new program manager.
Thank you so much, Patrice. And please make sure you take a look at the comments in the chat. Also wishing you congratulations and thanking you for your time. So yeah, we will be at our leadership team meeting later this month. We'll be doing a little special additional recognition for Patrice at that time. So if you have anything you'd like to share with us and make sure we get to her, please let us know. That's later this month, the 23rd. So before we hop into the rest of the agenda, we have had at least one additional, we have had two other folks join us, and I want to give them a chance to introduce themselves. So Nicolette, if you would just quickly tell us who you are and where you're from, that'd be great.
Sure. Good afternoon, everybody. I'm Nicolette Weinsweg, Vice President of Community Impact at United Way of the Wine Country.
Thanks for being here. And then Camille, how about you? I don't know if you're able to unmute Camille. In the meantime, also see that Lucretia just joined us. Lucretia, will you give us a quick introduction, please?
Hi, everybody. I'm Lucretia Renturian, the Executive Director of Mendocino Coast Clinics here in Fort Bragg.
Thank you. Okay, now I have to do this not suave thing at all that I do where I go back and look at, okay, what are my notes? What am I supposed to say? We have a couple of additional new sort of members here that we want to welcome as sort of official members of the Roundtable. One of those folks is Stephanie Gold, who introduced herself a few moments ago. And then the other person who I have on my notes is Ann Mulgard, who I don't think is here at the moment. Perhaps she will join us or not, but she's the Transitional Director for Public Health at HHSA as another sort of official member of the Roundtable. So welcome those folks, expect to see them and be collaborating with them. And let me look and see, I think you know, wave frantically, Patrice, if I'm wrong, but I think I'm now passing this over to you to give us a quick funding update.
Okay, so I'm sharing my screen. We went through this first slide. The next thing I kind of want to just give you guys an update on what's going on with our funding. We have 13 funding partners. Our newest partner who came on last fiscal year is the Mendocino Coast Healthcare Foundation. Thank you. This is a list of the logos of our funders, funding partners as of right now. And I just wanted to also kind of briefly tell you what the funders have been saying. I do an annual survey and talk to each funding partner every year to see how things are going. And most people say that they use the data indicators on the website. That's what's used the most, that and the demographics. They like the fact that they can go just to Healthy Mendocino to find most of the information they need when they're writing reports and writing grants. Very helpful for them for grants. They also like the fact that they know they can find resources on the site during emergencies, whether it's fire or the COVID pandemic. They like the fact that there was a collaborative CHNA because even though they may do their own needs assessments, they'll look at the larger collaborative CHNA that is done with other partners and mainly with the community, with the county, to see what came up in that collaborative and see how it matches with the assessments that they've done themselves. Public Health uses Healthy Mendocino and the collaborative CHNA for their accreditation process. The county is still trying to become accredited. One of the things that came up when I was talking to people is they see Healthy Mendocino as vibrant active, and a known and trusted organization in the county. So I was very pleased to hear that. That just felt really nice to know that that's what's, that's how people view us now. And usually we would kind of go out and kind of seek out, agencies that we could help and share their information, but now they actually come to us. We've had about 3 different agencies or groups or people come to us asking if we could help them share their information and put it on the website. So that's very, very nice. Healthy Mendocino, one of the things they said, they like the fact that it's beneficial in providing relationships among the agencies and leaders, especially through the roundtable that we have going on right now today, and that there's all this collaborative work and kind of sharing of information and a convening of multiple agencies together. So that was real nice to hear. Just a couple of updates. Just wanted to let you know about some of our featured articles in the last couple months. I'm actually going to go directly to the website now. This is our homepage, as hopefully most of you have seen. This month, actually, we're doing it. This is September, October. We did an article on substance use disorder and addiction in Mendocino County. We have some information about partnership. We also have a little thing about 211, since that's what we're going to be talking about today. And then I have a new web page that I want to show you in just a moment. But I also want to let you know that we update this area, the announcements, events, as much as we're able to bring in whatever events may be coming up within the month. So that's another section that we try to keep updated. Hopefully that'll be updated on a more frequent basis now that Jamie Williams will be coming on to be our coordinator. But this page right here is our local health data from community partners. And the reason I'm showing you this, some of you may know about this, but I just want to let you know that we are finally having local data put on the website, which is something I've been wanting to do for quite a while. And if you have anything that you would like to have added to this particular page, please let us know. You can email me directly, email at healthymendocino@ncoinc.org. And we'll do what we can to get your information on this page. So Redwood Quality Management Company, they send out monthly, they send out a data dashboard. So every time I receive it, I just add it in here, and it's great. They also have their trends, for the year. So their information is on here. The public health, I received some information, some data from public health, because we don't always have current updated information, but Julie Beersley over at Public Health was able to get me some of this information that includes 2020 data, and so that's really nice. You can view this on this page. We also have child abuse statistics, which is something that came again from the county. This is coming from the county welfare. This is being sent to me by email, and I just add it in, and it's great. So now here's some more information. Partnership Health Plan has also provided some of their reports, and they will eventually, once they have it up and running, they will eventually be sending us their information. And our next roundtable, Partnership is going to come and do a presentation on the work that they're doing. And they do collect specific data from the hospitals and from the clinics that they work with. So we'll be getting that data. This is new, Mendocino Health Alliance. I just put this one up because they are now starting to have a data snapshot that they are going to be putting out regularly. So I'll be putting that on the website. So you can see that this can be another great place for sharing information. So like I said, please let me know if you have data or anything that you would like to share on this page. Then the other thing I wanted to show you is the Childhood Trauma Action Team, which started way back in 2016 when Healthy Mendocino was helping implement our community health improvement plan. They've been going monthly ever since then, and they have changed their name to the ACEs Community Resilience Team because they want to be working more specifically on ACEs. And they want to be working very specifically on becoming trauma informed, for the county to become trauma informed. So they've partnered with PACES Connection which is now here on their page. And I'm going to have Roseanne talk about this partnership with Paces Connection, because she can give you a better soundbite on what that means for our county. Roseanne?
Thank you, Patrice. Hello, everyone. Roseanne Ibarra. So I'm stepping in and putting on my child advocate hat that I always have on. But yes, Patrice is absolutely correct. And I do also want to say that the Childhood Trauma Action Team, there was a group already in place. It's a subcommittee of our Policy Council on Children and Youth. So that's our Child Abuse Prevention Council that was working on these issues. And then when our 2015 Community Health Needs Assessment came into being and we identified our priorities, one of them was childhood trauma. And that's when that work was folded up into this subcommittee. And so fast forward, the advocates have been working hard and collaborating on this work and identifying, the first thing I remember back in, was it 2008 when Dr. Vince Folletti came to Mendocino County, and the rationale there was to bring the ACEs science to Mendocino County and inform our healthcare providers and our helping professionals about this work and how deep trauma, adversity, and toxic stress go for an individual, and how our bodies are, we have biological responses to these things, and that it predisposes us as well to chronic health conditions. However, it's not it's not a destiny for someone either, that there are things that we can do, there are interventions we can do, hence all of the work that you've been hearing around building resilience in the community. So I want to thank Healthy Mendocino for supporting the work that the child advocates have been doing since a long time. And now that we have this page on Healthy Mendocino, so the intention is what we're wanting to do is build a resilient Mendocino County. And so we've joined Paces Connection, which stands for Positive and Adverse Childhood Experiences. There's a website that I'll drop in the chat here in a minute that you can check out. There's a wealth of resources available there. But the beauty is that there's a community resilience tracker that we'll be launching. And what it is, it's looking across different sectors. So thinking about the justice system, faith community, childcare, education, a number of all the sectors that are within a community, and looking at which, what are the organizations that are joining us on this path to become trauma informed. And so looking across sectors, how many organizations within those various sectors are on board. And so we want to push this information out to everyone, and please feel free to reach out to me, Julie, Miranda. There's a number of us, Camille on this call, Victoria, that are Lily doing this work. And so it's exciting for us, and it's timely. When we think about Mendocino County, 70% of adults, and likely more that we don't know of, have had at least one adverse event in childhood. And although it's, within the title, it mentions childhood, we're talking about the full lifespan of an individual. So this impacts everyone. So thank you for that. And then I want to queue up the next conversation. Patrice, are we ready for that? Okay.
Yeah.
So part of this work of becoming trauma informed, right, and thinking about what are the things we're doing to address ACEs? What are the programs that we have in place? Where are we at with screenings? Who are the providers that are conducting screenings? And then what is the referral system and process that we have in place? And so as many of you know, especially during the pandemic, there were a number of different resource guides that popped up out of necessity. Because we needed to know, what organizations are open, who's offering which services, and it's needed, but it's also not the most efficient way to be organizing information, especially when it's constantly being updated. So I know in the past, we'll be hearing soon about 211, and in the past here in Mendocino County, 211 launched in, I think it was 2012?
2009.
2009. Okay. We had the first launching, and it was a little bit bumpy. And then there was a second launch. So it's been launched twice in Mendocino County. And I know for those of you on the call today that are familiar, it's been challenging, and that the phone line didn't work sometimes. The website was down sometimes. One of the other challenges is keeping the website updated with the contact information and the requirements, right? So if there's a specific program and then you have, there's certain things that need to be met in order to qualify, so many things that change. So the management of 211, and I'm talking about experience from First Five Mendocino side. When I was with First Five, we were one of the original funders along with the county. So the vision overall for 211 is a good thing. So it's to have an online platform, right? And a phone number that someone can call. So you call 211 to get access to human services, right? So resources, whether you're needing food, you're looking for housing, you're looking for childcare, all of those things. It's a one-stop shop where you can call and get connected, and you talk to a human being, which is great. So, but I also want to acknowledge that there were challenges with it. And so I know that there's been frustration. I know I've been frustrated, and I also want to be transparent with the group. I'm a board member representing Mendocino County, part of United Way board member. So 211 is one of the signature programs and projects of United Way. And so we're at a place right now where Mendocino County approved, I believe it was $50,000 back in July for the project to revitalize 211. And I know at the Child Advocates table at our ACES Community Resilience team, we've had conversations about what would be beneficial. And so there were conversations about Aunt Bertha and Lily, if you can speak to that more, about what that could look like to pair the two. So I want to invite Jennifer and Nicolette forward to dive into this about 211, and then for us to hear from them, and then we'll have a conversation after.
Thanks, Roseanne. So my name is Jennifer ODonnell. I've met some of you. I'm the Executive Vice President at United Way of the Wine Country. And United Way of the Wine Country we're part of a larger United Way network, really across the globe. But we're our own independent United Way. We cover Sonoma, Mendocino, Lake, Humboldt, and Del Norte, staff of 12. We have our own board, our own budget, and our own mission. So our mission at United Way of the Wine Country is to increase family financial stability throughout the service area. And by family financial stability, we mean however you define a family. And financial stability is really just about having enough to make ends meet, and then maybe a little extra for savings or something, just to make sure that you don't have to have so much anxiety and worry in your life. We address that through being a fundraiser, grant maker, advocate, and then we also have two programs. And this is running 211 is actually a little bit new to us. We've been a funder of 211 for many years, but we just began our role running a 211 in Sonoma County a couple of years ago. So Nicolette's going to tell you in more detail kind of how that looks and how that works, and try to get feedback from you on how you would like it to look. But my job is to just give you a little overview of what it is in case you haven't been here since 2009 and want to know what 211 is. So it's meant to be the go-to resource when people need compassionate help navigating services or resources. And so it provides access to community, health, social, and disaster services. We want to make sure people can access it in whatever way they want to and can. So there's both phone, live help, texting, chatting, social media, and web-based technology. It operates 24 hours a day, 365 days each year. The information is available in 150 languages. So if somebody calls up, whatever language they speak, they're able to connect with a translation service. And then in Sonoma County, and we're hoping in Mendocino County as well, we've played a really important role in providing incident-specific information in coordination with emergency services. I'll give you an example. Just a couple of nights ago, I got a call that 911 was being inundated with phone calls because for whatever reason, they still haven't decided why. Within the span of 2 hours, there were 15 fires in Sonoma County. And so they called us up and said, please, can we have people call 211 so you can tell them there are no evacuations at this time. And so we were able to do that. So that's just one example. We don't run a call center in Sonoma or in Mendocino. So our role as United Way is to coordinate the whole program and coordinate all the partners. So we contract out with Interface Children and Family Services. It's a nonprofit in Ventura County. They've been doing this work forever. They service the call center for 21 different counties. And by working with them, not only are there cost savings, but we can also leverage their professionalism and their well-trained workforce. The other benefit we've seen is that when we do have a disaster locally, it doesn't impact the call center. 211 used to be run locally in Sonoma County and was not able to open within the first few hours of the 2017 wildfires because it was within an evacuation zone. What else do I need to tell you? So the way we try to keep a local connection, even though the call center is not in Mendocino, is that we will work with local partners, and United Way will serve as that bridge and connection between Interface and the local community, so that we make sure that information is accurate and that people are getting what they need. And we're also providing that feedback loop to the call specialists. And with that, I'm going to turn it over to Nicolette, who truly is our 211 expert as our Vice President of Community Impact, and she's going to tell you a little bit more. And then we're going to open it up for questions and comments.
Thanks, Jennifer. So Jen basically went over this slide about how 211 works, phone, texting, website capability. So what I really wanted to talk about was kind of this journey of 211 Mendocino. Roseanne had talked a little bit about it in the beginning. So 211 Mendocino was started as a partnership between First Five, the County of Mendocino, and United Way in 2009. And during that time, the Volunteer Center of Sonoma County was taking the calls for 211 Mendocino, and us three were funding the work. And then it kind of didn't work. And so several years later, there was another relaunch of 211 Mendocino, again with the same three funders, but the calls were being taken by a 211 in San Bernardino. The problem with this partnership is that we were all really invested in making 211 work, but it didn't have one owner. It was this kind of collaborative between these funders and then a call center that was taking the calls. So the difference now is that we have an owner of 211 Mendocino. United Way of the Wine Country is completely committed to operating 211 and making it sustainable in funding and in serving the community. And so we have been working with the County of Mendocino for the past 18 months, talking about how we bring 211 to Mendocino, how we can partner, how we get the funding, and then discussing our staff capability, because we know that there was concerns about the way that it was operated in the past. And, as Roseanne mentioned, the county did give us a sizable investment to start this work. And so they really wanted to make sure that we would be able to do this. And as Jennifer said earlier, we are fairly new to operating 211. In July of 2019, United Way of the Wine Country transitioned 211 Sonoma from the Volunteer Center to operation within United Way of the Wine Country. The Volunteer Center had been running 211 for a number of years and went through a strategic planning process and decided that it didn't fit within their scope of what they wanted to do as an organization anymore. And we felt it made a lot of sense for us to take over 211, as a lot of United Ways across the country are the backbone organizations for 211. And so we looked at the models, and as Jennifer mentioned, we decided not to have a call center in Sonoma County and work with Interface for all of the reasons that she has mentioned. And it's really turned out to be a wonderful partnership. They come with the technology expertise, they come with the database management expertise, and they come with that staff training expertise. And so we really want to be very frank with you guys and say, we understand the issues that have happened in the past, and we understand that there is a lot of hesitancy to refer clients to 211 or even to update your information in 211, because why would you if it's not being used correctly? But we have seen great success in our ownership of 211 Sonoma, and we look forward to taking those skill sets and transferring them to 211 Mendocino and ensuring that this is a really smooth transition. And so while we haven't publicly launched 211 to the community yet, because the database hadn't been updated for 5 years, we're taking this time to go through and contact agencies and get the information updated in the database. We did start taking calls July 1st of 2021 to ensure a seamless transition, so that if somebody does call 211, the handful of calls that 211 Mendocino gets each day, that they're actually getting answered, and that they're getting answered by trained call specialists. And we went through and identified the top 15 referrals that had been made over the last several years and made sure that those were the first agencies that were updated. And we've gone through now and we've sent out agency update emails to all of the agencies in the database. So you may have received one. Hopefully you updated your information if you did, because the service that we provide to our community is only as good as the data that is in the database. So we're really relying on our partners to update their data. And so we just received a list of, the organizations that hadn't responded yet, and out of a list of, I think, 150 programs, only 28 hadn't updated their data. So we're on a really good path to getting this data updated. And once we have all of that, we'll be able to launch our website. So that is one thing that is not in operation right now, because we didn't want anybody going to the website and receiving incorrect information, either location, hours, or that organization doesn't even exist anymore. So we are working towards that. And I think that, this was the slide that I should have been on. Our challenges, our launch and relaunch, lack of consistent service and lack of ownership. But we have begun to address all of those issues. And we really do look forward to working with the community-based organizations in Mendocino County to ensure that we have the most accurate and up-to-date information, and to launch this to the public and have a very robust marketing campaign so that we have residents in Mendocino County who are in need, because we know that there are a lot, especially, all of these needs exacerbated by COVID. We want to be able to connect residents and callers in Mendocino County with the services that they need to push them towards financial stability. And so I'm going to stop there for questions from anybody, and then I actually have a question for all of you.
I guess I have a question, since I don't hear anybody else chiming in yet. Since you folks have done a good job of sort of understanding what some of the current attitudes or landscape in Mendocino County are around 211, and you understand that there might be some reticence or even just a lack of connection from the various organizations who you would want to make sure are listed on there. What are the strategies that you're using to make sure that those connections are made?
we are having a lot of one-on-one or small group meetings with stakeholders in Mendocino County. Our plan is to, I had sent an email out to everybody that was in the database saying United Way is taking over 211, please update your information. And I know that that's definitely a first step, but not, the step to take. So our plan is to begin reaching out to the organizations that are in the database individually to talk to them about what's in their listing, if there's anything else, if they have any questions, hopefully that we can help alleviate some concerns. We've been working very closely with the County of Mendocino. Lily has been super helpful in taking a look at the listings in the database and telling us like, this isn't the contact anymore, or this organization doesn't exist, or let me put you in touch with our housing people and they can give you the top 15 housing referrals so that we can start to get people to update their database. And we realize that, I live in Sonoma County, I'm not boots on the ground in Mendocino County. And so I am relying a lot on our partners in Mendocino County to help spread the word about Mendocino 211 and tell people like, this is going to be a service that you can count on. This is going to be a service that you can use. And also to identify additional folks that we need to talk to.
Thanks. I see that Lisa has raised her hand. Oh, you're muted, Lisa.
Hey, Nicolette, this is really great. Thank you very much. I'm glad to hear about this. And so I have a question about your categories for inclusion in 211. And, it's really helpful. I'm with public health nursing, work with maternal child population, and do home visiting programs. So the idea of having a mapping for referrals is really super. I really appreciate it. So how do you determine categories? And so, for example, for children and youth with special healthcare needs, is that something that is addressed, or do I come to you and I say, hey, you really ought to include this? Or could you talk a little bit about your template?
Yeah, so for the end of your question, yes, please. If there is something that you see that you're like, this is completely missing, or I know that there is more than one agency that's providing this and you're not seeing it in there, we absolutely would like you to contact us and say, this is missing. The way that information gets inputted into the iCarol database, which is our database that we use for making referrals, because we know that organizations can, provide many programs that cover many different areas. And so there's taxonomies assigned to them. And so it would say that this program is mental health. And then it would further detail that into adult mental health or child mental health, or however that goes. And we follow AIRS standards. So it's the Alliance for Information and Referral Systems. So they provide us the guidance on how to identify all of these resources. And the really nice thing is we were talking with Lily and Veronica at the county, and they were saying that they also use this AIRS taxonomy. And so in the future, as 211 evolves, there's a possibility that our 211 system could talk to the housing system. And so we would know, how to make those referrals and make sure that we're all aligned on how we're entering these into the database.
Chloe, I see you have your hand up.
Yeah, hey, Nicolette, thanks for presenting. I'm glad that somebody's owning this now. So I'm the director of Anderson Valley Health Center, and we're part of a consortia with the Southern clinics, the clinics mostly in Sonoma County. And Miranda, I heard you mention Aunt Bertha earlier. So I guess I'm kind of wondering what the discussion was with the providers down in Sonoma County. And it seems like they've really run with Aunt Bertha. Is 211 parallel to that? And then there's also Purple Binder. So I'm just kind of wondering, how did we decide on 211 and what was that? What did that process look like?
Can I take that one, Nicolette?
Yeah, sure.
So in Sonoma County, there's a big effort to create something called a community information exchange, or sometimes you'll hear it referred to as a closed loop referral system. And so a lot of us have come together, including the healthcare providers, Redwood Community Health Coalition, St. Joseph.
Right,
Kaiser's doing kind of their separate thing, but we're trying to figure out how to align. So it's the thing that people get confused about is 211 is not in competition with Purple Binder or Aunt Bertha or some of these others, because none of them have a call center feature to their technology, and they're for-profit technology companies that don't have a local presence. So in Sonoma, the talk is, how do we link everything else up with 211? Because what 211 doesn't have is we don't have the technology to do the closed loop referral. So the health centers in Sonoma actually stopped using Aunt Bertha, and they are looking to use 211 and then whatever technology is determined to do this closed loop referral piece. And actually right now, because we think we'll never come to a decision about which one, because Kaiser loves Unite Us and some other systems who may be using it for we're looking at trying to figure out how to make all the systems talk to one another. So each piece sort of brings a different aspect that's helpful. But it's gotten very confusing because there are a lot of for-profit tech companies that are out there really trying to encourage people to buy their product right now. And it's sort of confused a lot of the conversation.
I would say that 211 is complementary to these platforms, and we're exploring how to share our data so that regardless of what platform you're using, you're seeing the same information, and that hopefully CBOs are not having to update their information in Aunt Bertha and in Unite Us and in Activate Care and in this, because it's hard enough getting organizations to update their information in one place. And so to have them do it in 4 places is crazy making. And so we're really trying to remain vendor agnostic when we look at these platforms, and really position ourselves as the go-to people or the go-to organization for up-to-date and accurate data to live within those systems.
Great, thanks.
Lily, did you have a question or something to add?
Well, this might maybe the time for me to jump in. I'll just do it. Okay, so I'm working on the 211 contract through the county, but I'm also have a program that is a resource to the community. I also work with clients who I need to refer out to resources. So I'm a stakeholder like we all are. We all really need a great resource and referral system. And I'm motivated to have us figure this out soon, this year maybe, because we've been going on forever in this conversation about resource lists, resource database, referrals. So I'm excited about that we have 211 back or coming back, and been working closely with Nicolette on that. But I also know that every organization is having conversations or doing work to create their own resource lists. And there's also some large organizations in our county that are working on possibly contracting with other platforms like Unite Us or Aunt Bertha. And I want to make sure, we all want to make sure that we're all in communication. We're not duplicating efforts. We're working together and collaborating, and we're getting a system that works for our community and then also works for our agencies and resources. So I think that's where we're trying to go. And I am facilitating an informal conversation around resource and referral databases and lists coming up on September 30th. And this conversation, the way I'm envisioning it, is those who should attend are those who are doing work or at least researching database systems. So if you're in the process right now of like, oh, I've looked into Aunt Bertha, we're going to go with this. Maybe my national organization that I'm part of is going with Unite Us, so we're going to do that. Then please join us in this conversation, because I want to make sure, because I'm sure that there's going to be some organizations within Mendocino County, because of their connection to larger organizations, that are going to be working with some of these other databases. And I want to make sure we're all working together, because as Nicolette said, you know, as resources, we do not want to be entering in our information and updating our information a million different times to a million different places, because it won't be good quality information. We want to make sure that whatever database the agency or the client is accessing has the most up-to-date information, and it's easy for them to get referred to the organization and a follow-up in some way. So we got to keep working on it. So if you're interested in joining this conversation later on, so that we can make sure we're all on the same page, email me, call me. Yeah.
And then,
Thank you, Lily.
Yeah, thank you, Lily. We're looking forward to being a part of that conversation and really furthering this work in Mendocino County. And I just wanted to quickly ask and put it out there to you all, you know, knowing what you know from the past and what we've talked about now, if you could wave a magic wand, what would you want Mendocino, 211 Mendocino to do or to look like in the community?
Okay, well, this is Chloe again. I mean, I think for me, what really matters is the client facing side of it, that, you know, the whole county knows when they think of a resource that's up to date for where to look, that they think of 211 and they go there, and it's kind of, you know, the word is out in all languages that we need it to be, and they can get accurate information. And we, as healthcare providers, can get accurate information.
Hi, this is Tim from Mendocino College, so I'm a little bit different since our college. My experience with 211, I'm new to the area too, 14 months, but it's been in the Bay Area, where they have 211 in Bay Area through the United Way of the Bay Area. It's been up and running for a few years. So I was down there working when that formed and with birth. And for student services or student-facing services, when we have to make information referrals either at our library or in some of our student services platforms, this type of service is really great for us. There's one platform for us to know just to give a list to a student for potential help, and also for referrals towards us. I know, like in the Bay Area, there was a tab where if you needed English as a second language instruction, it could either go to the college programs or a community program offering those services, or if you needed migrant education, there were other avenues to get to college or educational partners, which we always found really helpful. Also for us just to find out who our partners are in the counties, because sometimes that's the bigger question, is like, who are your partners? And we use this many times to investigate when I was in the Bay Area, who to contact doing coalition work and other things like that. So I think it is a powerful tool for a user facing service. And if it's anything like the one we had in the Bay Area, it was a pretty intuitive tool, I think, to use, and the language part was just super helpful.
Thank you.
Nicolette, do you want to talk about the website design a little bit?
Yeah, so as I had mentioned, the website for 211 Mendocino is under construction right now, and that's mainly because we're waiting for the database to be updated. And so once it is updated and the website is launched, it will look very similar to the 211 Sonoma website for now. So if you go to 211sonoma.org, you can see a representation of what the 211 Mendocino website is going to look like. There's a homepage with little buttons on it that you can click for different need categories. So housing, food, senior services, veteran services, childcare, etc. There's also a guided search. So if you have an idea of what you need and you don't want to use the little button, you can go to the guided search and search for food resources or mental health resources or childcare, whatever you need, and filter it by proximity to your location or There's several other filters. And then one of the really great pieces on the website that won't be available right away, but will after about 6 months after the initial launch of 211 is the interactive reporting feature. And that is a reporting feature that you can see how many calls and texts we've received. It breaks down into different demographic groups. It breaks down into different cities and zip codes. It breaks down into top referrals and top needs and the subcategories of need within those needs. So you can definitely go and check it out on the Sonoma website. And then in the future, it will be available on the Mendocino website. And it really gives us a good snapshot of the need in the community. And you can, like I said, break it down by all demographics. So once the website is launched, we'll definitely put out the word to everybody about that. And also, once the website's launched, that means that our resource database is where we need it to be, so we'll be able to do our full public launch as well.
Leah.
I actually have a question. So I'm curious about the user experience. I would imagine sometimes when somebody calls, that can move from sort of asking for a referral into a bit more of kind of a, somebody could be in crisis, is wanting to talk. I'm just curious sort of what that process is if somebody is calling with, greater needs, obviously, than just a phone number, how that's dispatched or how that's handled.
So when a caller calls, there's demographic screening information that they are asked at the beginning of the call. They are able to decline that if they don't want to. And if the call specialist can, tell that the person is in dire need or crisis, that they will skip that portion of it. The nice thing about having a phone call and talking to the call specialist is even if they're calling for housing and it doesn't seem like they're in crisis, they're continually asking them other questions about if they have children in the household, if they're a smoker, if they're this, if they're that, to identify different resources that they could be referred to, CalFresh being one of them. If they truly call in crisis, that's a really great question. I know that we have resources to refer people to for crisis lines, and I do think I should confirm this, and I can follow up with you all after, but I do think the call center does have the ability to do a warm transfer, and they do that with some of the services at the county. And so my understanding is if they're in true crisis and they need to be referred to a crisis line, that they can give them a warm transfer there. So it's not just a here, call this number, okay, bye.
Lisa?
Yeah, I had a question about, and you're speaking a little bit to it earlier about what are the process for keeping the site fresh, and you were talking a little bit about closure and tracking closures, and could you speak a little bit to the process of just making sure that what's on the page is actually live?
Yep. So it's standard policy for us to do a biannual update. So we send out requests for agency update in January and in July via email, and it's followed through by our resource team until we have 100% participation in the update, or sometimes we have a couple that we're not able to connect with, and so we're looking at 98% update. So that's when we call it complete after several tries. And then with our conversations that we have as just 211 advocates, and when we're doing outreach, when we're talking to CBOs, is just remember, if you have an updated program, or if your hours change, or if your offerings change, to go in and update it on the 211 website. You can, once the website is live, you can go to your own resource listing and request to submit an update. And then you type in the update, it gets sent to our resource team, and they just verify that there's no errors in formatting, spelling, that it's meeting our inclusion policy, that you're not, charging for exorbitant amounts of money for services and stuff. So that's part of our inclusion policy. And then it gets updated. During COVID, I know that we're still in COVID, but during the kind of height of COVID, we were doing monthly updates because we knew that things were changing so fast. And so we really wanted to put 211 in everybody's heads, thinking, you know, to have them think that when we have a change, we need to update the database. And then as staff at United Way of the Wine Country, our 12 staff members are always wearing a 211 hat. So if they're at a community meeting and they hear you say, we're introducing this new program, or we've had to cut our hours or something like that, we're always asking them to come back to us with that information so that we can then verify it with you and update your listing.
I have another question. I am curious as to what your marketing strategy for when it goes public is like. We've spent the last forever, but especially the last 18 months, trying to figure out how to most effectively get information to the people most in need of that information.
Yeah.
And where we feel like we have some successes, I think that's still sort of an outstanding question for us. I'm curious as to what your strategy is around that.
We don't have a developed strategy as of yet. I think that it's going to be really important to talk to our partners to find out kind of what's worked and what hasn't. Obviously, I mean, I think that we know that with anything, that word of mouth is usually the most effective, right? If I say like, oh my gosh, I called 211 and it was fantastic and I got, you know, connected to all these referrals, you're probably going to call too. So we've seen some success in Sonoma County with radio ads. We worked with a marketing company that does marketing specifically in Spanish language to the Latinx population, and they put our ads on TV screens in the supermarkets, and that was really effective. And then another thing, and this is, you know, kind of just by happen chance, because we've had so many disasters and emergencies, and we're, as part of the public information team for the county, they have really pushed 211. And so what we see is that a lot of people know that they can call 211 in the time of emergency and disaster. And so now we're trying to build upon that you can call 211 in any time for whatever you need, health and human service wise. So we're definitely going to start the conversations with you all and more community members to see kind of what works the best. And we're really open to hearing what's worked and developing strategies like that. So,
and we another strategy we've used in the past is to contract with nonprofits that are more on the ground and talking to people. So, for example, we contracted with somebody who does disaster preparation work with farm workers in Sonoma County and the Latinx community. And she, you know, literally goes out to the fields or out to wherever people are and talks about disaster preparedness, make sure they know when to call 211, when to call 911. So that's another strategy we can use in Mendocino, is to find out who's the most connected, who really reaches community, and then support them with funding.
Thank you. Sage?
Yeah, thank you for the presentation. I was interested on the emergency services aspect of it as the city, and how do we put our emergency service managers in touch with that aspect of the 211 program, because that's not something that's something that could happen, you know, in any given hour, and appreciate the responsiveness to that potential need.
Yeah, so we have a formalized agreement with our county, and through that have been put in touch with all of the city PIOs as well. But for now, I mean, you know, I'm the contact, Jennifer and I are. In fact, we are on call this evening because there's a red flag warning and dry lightning storms, you know, for Santa Rosa. And so it's literally just calling my cell phone. And then I relay the information over to our call center. So I would definitely welcome, you know, a meeting with you or your emergency management folks to get that relationship started.
Great. And just doing the same, you know, following the same model that you have for the county of Sonoma, and given the contract is through the county of Mendocino, that starting with their emergency service operation, you know, and maybe having a a meeting that includes, them plus the counterparts of the appropriate cities might be a great start. So I know the city of Ukiah would be happy to participate in that. And make any linkages that we need to make in that area. But I think you guys have contacts with the county of Mendocino, and that's probably the best place to start for that meeting.
Yeah, and Lily and I actually were just talking about that last week, I think. I feel like we've had so many meetings. So it's definitely on our radar to get those relationships established.
And the county of Mendocino has already contracted with United Way to do this work,
but not for disaster services.
Not
So
right.
there's
We have a very minimal contract right now. Yeah.
So the way it works with the County of Sonoma is they can choose to activate us during disaster. So usually it's a bigger disaster where you would normally have to set up a call center. So instead of setting up a call center, we can call interface and say you're going to need to put 10 to 15 more people on the calls. And then we're able to ramp up. Without a contract, we will still take disaster calls. I mean, we'll still answer any questions people call about. It just means there could be longer hold times and, less. We need to work on the coordination piece so that we truly have the information that the county and the cities want us to push out. So that's a good idea to have a meeting with everybody and try to coordinate.
Great, thank you. We look forward to that.
Thank you. And I saw that Joanne had put in the chat that it would be nice to have tobacco cessation, etc. resources under substance abuse misuse or under its own topic. And I completely agree, and we will work on putting that in. Thank you.
I'm interested to hear if other folks have answers to your question about the magic wand.
Mm-hmm.
Want to encourage people to voice those.
I can tell you that my magic wand thing that I would like is what we were talking about before, which is being able to track the outcomes of referrals. So right now we know how many referrals we make, we know where we make them to, and we track client satisfaction with those referrals, but we don't actually know that the person who called needing food got food, or the person that called needing to get in a shelter got into a shelter. So that's that next step that I think Lily's working on with the different technology platforms, which would be wonderful.
And this is Stephanie. I don't know that I have a magic wand answer, but I'm thinking about how this would relate to housing crisis. If a family found themselves in some sort of housing crisis, would it be an appropriate venue for them? And if so, what sort of thing could they be hoping to gain from it?
Yeah, so it would definitely be an appropriate venue. We are working with Interface, our call center, to be able to do emergency rental assistance program application assistance at this point. So that's kind of one little piece of it. When folks call and are in, housing crisis and need rental assistance or need a referral to a shelter or need to be connected with coordinated entry, 211 can make that referral. And so what we're doing right now, especially in housing, knowing that that's a really big need everywhere, is I've been working with Lily and Veronica at the county to identify shelters and housing options so that we can get those into the database as kind of that first key piece that we focus on. And so that's really at this point, a referral to an agency that's providing rental assistance or a shelter is where we're at.
Thanks.
Lucretia, I think maybe you had a question or comment?
Just because we've been coming up with ideas on how to get information out, as Miranda said, and one of the things that people that we were in a meeting earlier this week, I think, could have been last week, could have been a month ago. But they were saying, you know, don't forget like faith-based organizations. I have found radio really important in the word getting out about vaccination and testing and that kind of thing. But the other was just putting flyers out and having laundromats, especially this population. I think that that might be a good way to have things out there. But I was thinking about another place that they said other than faith-based, and now it's escaping me. But I think you want to go low tech and high tech to really get the word out.
We're also exploring, this has been something that's kind of been on the back burner for a little while, but I'd like to see happen in both Sonoma and Mendocino County, is providing our first responders, our law enforcement and firefighters and paramedics with the 211 card. So when they do encounter somebody who may not be in a critical crisis, but they recognize that they have a need for services, to give them the 211 information. And also for, you know, like our home healthcare workers and stuff like that, to be able to have that information. There is a function on the website where you can create an account and you can save resources. And so if you're a home healthcare worker and you encounter, you know, a lot of people that are food insecure or that, you know, need whatever it is, you can identify the resources on the website and save it, and it can be printed out or it can be used to help connect folks with services. And so that'll be a really wonderful tool as well, until we do get these kind of closed loop referral systems in place.
I'm wondering how many in Sonoma County, how many referrals do you make? I don't know what the right time frame to talk about, a day, a week, a month, a year, I don't know.
So last year, fiscal year, June or July 1st to June 30th, we had about 31,000 calls and text messages. And generally, when a referral is made during those calls and text messages, it's more than one referral. And so I really haven't actually looked at the number of referrals. We look at the number of contacts. And so we've had about 31,000 in a year. So we're averaging over 2,200 calls a month. And that is increased because of COVID. We did see a very large increase in calls due to COVID, and people were calling not just for referrals, but they were calling for information. So where can I go to get tested? I guess that's a referral, but what's the most current health order? What's the most current masking order, that kind of stuff. And so we were tied into our county as well as the state requirements so that we could give them that information. And then we did have an increase in calls over the summer because of the 2 fires that we had. So that's where we were at last year. I'm curious to see if that continues this year, if we see a big need for services as we did last year. I can tell you though that the top referrals that we see are housing, food, and utility assistance. And then with COVID this year, healthcare was the number one, but that's because everything COVID is kind of wrapped into that healthcare piece.
Does your team, it sounds like it, I guess I want to make sure I understand it clearly, that when you started getting those questions around testing or vaccination or fairly COVID specific questions, that especially around health orders and things like that, was the call center just sort of going to the publicly available websites and citing that information, or did they have a clear connection where they were able to get the most up-to-date information? Because I hate to say it, but our county websites around this sort of information is still at this late date not kept particularly up to date. It would send people potentially, or it would be missing information or providing old information if the call center were relying solely on that.
Yes. Yeah. And we've seen that through COVID. We saw it with our fires and post-fire recovery, that it does take a while for counties to get the information up, and it takes a while for them to update it too. So I participate in a weekly operational area call with all of the city jurisdictions, the county, the fire department, public health, all of that. And so I relay that information to the call center. And then I'm also on a weekly call with public information officers. And then we're also in weekly meetings with community-based organizations that are providing resources. So what we did is we created a whole Google spreadsheet basically outside of our database for resources that were constantly changing, vaccine clinics, testing, health orders, that kind of stuff. And we would go in and update it so that we could see it, they could see it, anybody that we shared it with could see it in real time. We are relying a lot on the SoCo emergency webpage that has the COVID information. Things aren't moving as fast now as they were. And so we're seeing that that's helpful. But definitely if I'm hearing information in the meeting that hasn't been updated on the county website, we're relaying it to the call center. And then the call center is also letting us know, hey, we're hearing this, or where is this information? And so we're able to proactively or reactively at that point, go to our county contacts and say, what number do people call to report masking violations, or where's the most current vaccine clinic information? And we're also able to kind of do some rumor control during disasters and this pandemic now that people had heard that this was happening. And we got a few calls about that so that we could relay it to the county. They could give us the proper information, but then they could also put out on their social media channels that this is actually what's happening. So it's been kind of this nice feedback loop.
Thanks. Folks have other questions or comments or feedback?
Yes, I do. I would like to say that having never called 211, I'd like to know if we are going to have a chance to do a demo or role play or try it out and experience it, if there's going to be an opportunity for that, to do some trials and give feedback in that way.
Absolutely. My suggestion to you all is once we kind of put the public launch out, or once we have our database, where we need it to be to launch publicly, we can let you all know. And I encourage you to call 211 with whatever need you want to present to them. So it doesn't have to be a need that you want. You could pretend to be a 55-year-old woman who needs food, or a 27-year-old woman with a 2-year-old daughter, whatever scenario you would like to make up. I highly recommend that you do so and do kind of a secret shopper call. And then please provide us with feedback. Good, bad, suggestions, whatever it is, we're totally open to that. We do it occasionally. And I think that it's important to know that, you feel like you've gotten the correct information, or that you haven't, or, what your experience was. So call. I recommend that you use the texting feature. You can text your zip code to 898-211 and have a two-way live text conversation with a call center specialist. You can also, once the website is up, check out the website, do a search yourself. If you think that something's missing, if you're not finding what you're looking for, if you see something that needs to be changed, we are completely 100% open to feedback.
Thank you. I was thinking, as you were describing it, how helpful it would be with COVID contact tracing calls and people that are doing that. We have some things, of course, that we know that we can do resource requests through the Department Operations Center, but there are other things that kind of slip through in awkward situations where you really want to help something, and you also do want to know if you've closed the loop. So that is really important.
I guess I just want to comment that I'm really glad to hear about the text teacher. I know that's a good way to open things up to like, what's that age group, like 18 to 49-year-olds or whatever. I mean, there's an entire generations of people who do not want to use a telephone to talk into it.
That would be me, actually. I'm older than that generation, but I never want to call. But I'm glad there's a place people can call who need that.
I also will mention just one other thing with the texting. There's also another feature that you can text a keyword to 211-211, and then it asks for your zip code and it pushes out specific information on whatever that keyword is. So, you know, we use it sometimes for COVID. We've used it for fire. If there's something going on in Mendocino County that is easily communicated to people through push text messaging, we can set up another keyword flow, and you know, emergency rental assistance could be one of them. You know, they text housing to 211-211 and they just get that push text information. Obviously with that, you have to have internet access because it'll text you like information with a link to get to, you know, the resource. But that's another feature. We've been using it for COVID. And every once in a while, information's pushed out about vaccine clinics or testing availability or whatever it is.
I have another question. I'm sorry. Why do I have so many
Great.
questions? Well, so I am like, I'm intrigued and really glad to hear about how, you know, how connected you are with the Sonoma County and the ability to be so responsive. And I understand that the contract with Mendocino County is fairly, you know, fairly small in scope at this particular moment. But I do wonder about, you know, some of these features that you're talking about now, how we can make sure that those are going to be available and that those connections will be as solid. I mean, it sounds like in Sonoma County, so you're on those calls and you're, you know, they've got your cell phone number and they're like, here's this thing you need to tell the call center about right away. And I would anticipate that it would be quite a tall order for you to also do those things for Mendocino County. And so I wonder, perhaps this is a premature part of the conversation, but what it would look like in order to make those kinds of things accessible for us as well.
And I also want to share that, just being completely honest, the first time we were invited to be in the Emergency Operations Center, everyone kind of looked at us like, why are you here? Why would we use 211? I don't get it. And so that was in 2019. So it has, you know, it's taken a little while to get there. Part of it, you know, we can't take all the credit for. Our Emergency Operations Center has really worked hard on forming relationships between the county and cities and the local co-op. But I think one thing is we would, I guess, just humbly ask for your help to form those relationships. I see some people already put some names they suggest we talk to. We'll definitely, you know, talk to Lily more about this and just figure out how, because really that's all it's about, is making the connections. And then, like Nicolette said, they just literally have our cell phone numbers and call when something's going on. So anything you all can do to help us form those connections is going to be really great.
Thank you.
And just because our contract is smaller in scope, you know, than the Sonoma County contract, doesn't mean that you all can't contact me whenever you need to make an update or have a question or whatever. I'm here. I am totally open to answering questions, talking more about this, walking you through anything that you need to be walked through. And so I mean, like I said in the beginning, we are 100% committed to making sure that this works. And so we know that that's going to be additional time and effort in the beginning to make sure that everything is kind of the way that it needs to be before we really push it out there. And so please don't hesitate to contact me.
Yeah, and the most important thing for us was to get the data right, you know, because that's the basis for this whole thing. So that's where we started, but happy to, you know, explore adding other services or other, you know, building on top of what we're sort of the basic information and referrals.
I want to make sure to call people's attention to the chat. There's been quite a few pieces of contact information shared in there, and some comments and things like that people should take a look at.
I'll just put here, this is Jennifer and my contact information. You can reach out to either one of us. If you have updates specific to 211 questions, definitely reach out to me and I will make sure to get you connected with our resource team at 211 or to walk you through the website once it's up, or any other questions that you have. And really just want to send my appreciation out for giving us this much time and this great conversation and these contacts you all have put in the chat and your ideas. And we look forward to talking more and building upon these in the near future.
Well, thank you so much. I'm sure you will be getting some messages from folks, and we'll help you get that database even, you know, closer to ready faster, right?
Yep.
Any other final questions or feedback or comments for Jennifer and Nicolette? Okay. So we have a few minutes left. I'm always happy, especially on a day when I'm scheduled for 6.5 hours of meetings, for us to find a way to conclude a meeting slightly early. But I also don't want to hamper any discussion or items that you might need to share with this group. So if you've got something quick that this group ought to hear about, feel free to share it. Otherwise, I want to let you know that the next one of these meetings is scheduled for December 9th. These meetings occur on the second Thursday of the last month of each quarter. And we will be having a presentation from Partnership Health Plan at that meeting. And I don't know the specifics of that presentation yet, but I do know that Partnership is a very important organization in our community and to the people who we serve, and you know, is probably also going to be involved in the 211 conversation as these things happen, right? Lisa, go ahead.
Yeah, it's always me talking. I'm sorry, but I just do have and I just want to say again, Patrice, how much I have appreciated, you know, working with you, and Healthy Mendocino has just been such an incredible resource. I'm really interested to know where the conversations are taking place around community health needs assessment going forward. And I'm hoping that you can, you know, help shed some light. It's just a really critical part of how we do our work together. And I'm just really interested to know in next steps, where we're going, how we're going to keep track of what our needs are here in Mendocino County. So thanks, Patrice, so much.
Well, I can let you know that I talked with the county, specifically Donna, when we made the decision not to do the CHNA for 3 years. So we will be on track to do it within 5 years, which means that it'll start 2023 for 2024 is, I believe, what will be happening. So there will still be a collaborative CHNA that will involve the county, very much involve the county and all the other partners that were part of that planning group to do a full scale large county CHNA. Adventist Health is doing their own CHNA, which is going to include countywide assessment also. So that CHNA will be available and in our website once it is finished for other agencies to look at.
That's great. I'm hoping that that will also address the needs of Medi-Cal and underserved populations. So it'll be nice to see how that actually
Sure.
jibes with
Yeah.
what we have for CHNA needs. Thank you.
Anybody else? Oh, nothing makes me happier when I'm facilitating a meeting to end it early. I can fold some laundry before the next meeting.
Bye, everyone. Thank you.
Thank you folks so much. Thank you so much, Patrice.
You're welcome. And thanks, everybody. Thanks for being at the meeting.
Stay in touch, Patrice.